So I'm going to talk about what pseudo obstruction is and how it presents. And I think this is, for a lot of you, perhaps the easy part, because you've learned quite a lot about this condition over the years, because there's quite a lot of information that is out there. But I think it'd still be useful to set the scene, to just go through this. And if there are any areas that you're not so comfortable with, then we can discuss that in the question and answers session as well. So as the definition for chronic intestinal pseudo obstruction, as the term suggests, that the gut behaves as if it is obstructed, blocked, in the absence of a physical obstruction. So it looks otherwise normal. There is no tumor or any stricture which is blocking the passage of food through the gut, but it just doesn't move very well and feels as if it is blocked. And I think it'd be helpful to just get a visual image of what the gut actually looks like. And basically you can look at it as a tubular structure. So it's a tube that starts right at the lower end of your throat, which is the esophagus or the gullet, which actually then ends in this globular structure, which is the stomach. And I always explain this to my students. Think of the stomach as a mixer. So this is where, when you actually put all the food in and then you put on your mixer, it actually mixes all the food with the fluid that's in there. And in the case of the stomach, it's the acid. And the stomach is basically breaking the food down into smaller pieces. The acid is killing off the bacteria that you ingest with the food. And those small particles of food then start to trickle down into the small intestine, which is the bit here in the middle. Okay. And it is in the small intestine that the food starts to digest. So this is where the various enzymes are secreted by the liver, by the pancreas, and other parts of the body. The small intestine makes its own enzymes, and they all help to further break down the food into nutrients that then start to be absorbed. So you need the nutrients that you've eaten from the food that you've just eaten. So the gut knows what it needs, and the cells in the lining of the gut very actively start to absorb what they need. And they have very specific types of receptors or areas which recognize different types of nutrients, and they start to absorb the nutrients that they need. So therefore the small intestine is a very important part of the gut because of the absorption of the nutrients that is occurring in that part. And gradually the food makes its way, because some parts of the small intestine are particularly suitable for absorbing certain type of nutrients, other parts for other type of nutrients. So as it passes through this very long tube and reaches this part, which is the start of the colon or the cecum, most of the nutrients have been absorbed, and what you're left with is the waste. And the waste has to be excreted, and you have a long colon. It goes all the way, called the ascending colon, transverse colon, descending colon, which in the end ends up in the rectum. And the reason that it's so long is that there's a lot of fluid still in this waste that has arrived in the cecum, or the upper part of the colon. And this, if you were to lose all of that fluid, then you would become dehydrated. So the purpose of the colon is to absorb slowly the fluid as it goes along, and make the stools a bit harder, and therefore by the time they reach the rectum, most of the fluid has been absorbed, and then you expel the waste. So these are the basic function, but the main thing is it's a bit of a plumbing job. It's basically tubes, and therefore food has to move down this tube. And there is a mechanism for that to happen, and that is called peristalsis. Peristalsis is milking movements that milk the food that you eat down through the gut. And the way it happens is that we've got muscles in the lining of the gut. So if the food comes in, that stretch caused by the food coming in is recognized by the nerves that are in the lining of the gut. And they signal, and I'm going to talk to you about that in a little while, they signal to the muscles that there is something there, it's an obstruction, get rid of it. So the muscles squeeze, they contract. So there is an area of contraction here, and this is the food bolus or strawberry, and what has to happen is that the area below must relax, because if the area below the bolus is also very tight and constricted, then the bolus won't move down. So this is a very coordinated mechanism of peristalsis, that the area above contracts and the muscle layer below, where the bolus is, relaxes. And that contraction above, relaxation below, pushes the food down to the lower segment of the gut. And the same process starts in that segment. And that keeps happening till you expel the waste through your rectum. So that is the process of peristalsis. And it is managed by this coordination between the nerves and the muscles of the gut. And this is not a cannon. This is basically a cross-section of the different layers of the gut. And if you can follow the arrows, this is the inside of the gut. So if you were to look down the camera tube on the inside, this is the lining. The pink bit that you can see here is just really the lining. We call it the mucosa. This is where the cells are lining the gut. And then we have a layer outside it, which we call the submucosa. It's a bit of fatty layer just on the outside. And in this layer, the submucosa, there are these black threads that you see are basically nerves. There are lots of nerves just underneath the lining, and this is called the mucus plexus. And then the next layer is a muscle called the circular muscle, and the layer at the outside is called the muscle is called the longitudinal muscle. So there are two layers of muscles underneath the lining, and between these two layers of muscles, so the inner is circular, the outer is longitudinal. There is another plexus of nerves called the enteric plexus. So these are together known as the enteric. Enteric means gut, nervous system, the nervous system of the gut. And what people don't realize is that this is a very extensive nervous system. There are as many nerves here in the gut as there are in the spinal cord, if not more. So it is not surprising that just like you have diseases of the brain, diseases of the spinal cord, etc., that you can actually get diseases of the nervous system of the gut. And when that happens, because these nerves, the reason these nerves are so close to the muscles is that they're signaling to the muscles all the time. That's when the food comes in, it stretches, the nerves recognize the stretch, they send the signal to the muscles, squeeze, the lower bit, relax, the food moves down. This is happening all the time. And to control that, you need these nerves to be acting very well. Now, this is almost like what I've just shown you is like, initially you look at the gut and it's like a nice shining looking car. But really what makes these wheels go around is what's inside, which is the engine. So these nerves are the engine which really make, nerves and the muscles are the engine which make the gut move. Okay? And as we look at this nerve and muscle interaction, we actually see that these nerves, they actually come and connect with the muscles at very specific areas. So there are lots of junctions between these nerves and the muscles. As you would imagine, because there are so many nerves and the gut is a long tube, there's a lot of muscle there as well. And this would be analogous to just you take your car to the pump and you put the hose in and you're ready to fire. But things don't happen, your car is not going to move until the trigger is pulled. And that trigger is pulled when you have certain what we call chemicals or neurotransmitters. These are chemicals that transmit information between the nerves and the muscles. And the most important one is called acetylcholine. And this is present in the lower end of the nerves. This is the muscle where the nerve comes and interacts with the muscle. And when the signal comes down the nerve that we need the muscle to move, this chemical is released called acetylcholine. And that then causes the muscle to then squeeze and contract. And it contracts because on the muscle layer, there are these special areas called receptors which recognize the acetylcholine. They recognize this chemical and they say, right, okay, this chemical is coming. They these areas pick up that chemical, and then they translate that information to the muscle, which makes the muscle move. Hence, this is when you actually pull the trigger and the petrol is actually gone in and the car is ready to move. So there are nerves that are present in the gut, but the gut, like all the organs, like all the parts of the body, are not isolated. They're all connected with the big brain. We call the brain in the gut the little brain, but the big brain over here is also connected with this little brain over here. And this connection occurs mainly through the nerves, but there are also hormones. So these are again chemicals that move through the bloodstream up into the brain to affect what is happening, to allow the brain to know what is happening in the gut. And then there are hormones that go from the brain that come to the gut as well. And this interaction also occurs through the immune system. The gut is the largest immune organ of the body. That's because it has to always react to all these environmental antigens that are being consumed, foreign bodies that are being consumed. So through that interaction, there is nerves, hormones, immune system. There's a two-way traffic going on. And therefore, the fine-tuning of what is happening in the gut also occurs through the brain. And this is how stress can affect gut function as well. Because stress can cause effects on these nerves. It can affect the hormones. It can affect the immune system. And stress can start having an effect on the stomach. An example, a personal example, I remember whenever I was in medical school and I had to go for exams in the morning, I could never eat in the morning. I could never have breakfast in the morning. But as soon as the exam was finished, at lunchtime you were just raving hungry and you just had a big meal. Okay, so stress, that's a personal feeling that when I'm under stress, I lose my appetite. I'm under stress now and I haven't felt hungry at all day today. But once I've given my talk, I'm going to have a nice lunch. And we also mustn't forget this connective tissue. Connective tissue is, these are fibers, like collagen fibers, being the most common. You probably all heard of collagen. It's in a lot of treatments for the skin and so on. And be an organ in its own right. And the alternative theory of evolution is really that man was created to support the bacteria, because they came much before us, and they're basically going to be there when we're gone, and they will actually consume our body when we're gone. So they have a good time whatever happens. But these gut bacteria are mostly happy, healthy bacteria. They're very important for helping us with digestion. They break down the food into smaller particles, and they help us to break down and digest this food. They interact with our immune system. So they're very helpful to us usually, because they want us to be happy and healthy and live longer so that they can survive with us as well. But then if things start to go wrong, and they can go wrong in many different ways. We've talked about acetylcholine as the chemical which has to stimulate these receptors on the muscles. And these receptors, you can see these blue caps over here. This is in the sort of healthy situation. But sometimes the body's immune system overreacts, and it actually starts to produce antibodies against its own body, for instance. And these are the antibodies which start to then block these receptors. So there's not enough receptors that are available now for acetylcholine to act on. This is just one example of how things can start to go wrong. And now if you don't have enough receptors, no matter how much acetylcholine, this neurotransmitter you have, it's not going to be very effective against the muscle. Okay? And what will that do? That will make the muscles of the gut a bit weak. They will not work as well as they should. And because of that, the gut will start to feel as if it's obstructed and will start to swell up a little bit, and therefore you get this distension in the small intestine that starts to develop. And when that happens, there is stagnation. And stagnation anywhere produces bacteria, and unhealthy bacteria. And these unhealthy bacteria, they're very aggressive. They attack the healthy ones and try and muscle in, because they're the ones then they start causing problems with the digestion of the food. They cause a lot of fermentation. They release a lot of gases in the tummy. And these gases then start to cause the bloating and the pain, cramping pains. And then sometimes, although in the background patients often have constipation, diarrhea starts to develop because of malabsorption. They start producing malabsorption of food and particularly fat, and stools can look a bit oily, and the person feels a bit bloated, uncomfortable, and so on. But this is just one example of why failure of peristalsis may occur. There are many other reasons. The nerves, for instance, they can be inflamed through an infection. It could be a viral infection, such as a herpes infection. It can be bacterial infections, Campylobacter infections. And so you have an acute event, severe gastroenteritis, and then after that, things are never the same. The gut doesn't behave normally, and that's because the nerves in the lining of the gut have become inflamed, and even though the gut seems to have healed, the nerves do not heal afterwards. And it happens in a proportion of patients, not many, but it does happen. And that can lead to problems with movements of the gut. We've talked about autoimmune disease, that the body's own immunity starts to be active against its own tissues and therefore develops antibodies against the receptors. Sometimes these nerves are absent, like in Hirschsprung's disease. Chagas disease is a infective condition prevalent in South America. We thankfully don't see that over here. And then these nerves, sometimes when we look at these nerves, they seem to have degenerated. They seem to have lost their normal structure, and therefore their function isn't very good. The cause of that we don't know, but that seems to happen. And sometimes this connection between the brain and the gut gets disrupted through stroke, inflammation in the brain, diabetes, which affects these nerves coming down from the brain to the gut. That can cause. But there can be problems in the muscles themselves, which can be inflamed from the same type of reasons. And sometimes there is primary muscle failure in the gut. There's a condition called myopathy, which can be due to inflammation, but sometimes we don't understand exactly why it has actually happened. And there is a very rare genetic condition as well, which can lead to failure of muscle movement. We talked about the connective tissue, the collagen, which is very important, and in conditions like lupus, scleroderma, Ehlers-Danlos syndrome is a condition which is associated with very flexible, bendy joints. These conditions can also be associated with problems of movement in the gut because the supporting structures are not working very well. And then there are various drugs which can slow the gut down, used in Parkinson's disease, for instance, certain antidepressants, blood pressure medicines, and so on. There are chemotherapy drugs. There are quite a few drugs that can really slow the gut down. I haven't mentioned opioids because that will be mentioned later. And yes, there are some genetic causes of pseudo obstruction as well. The exact gene has never been identified, but there are individual cases where certain genes have been implicated and certainly in some twin studies, etc. There has been some concordance as well. So the theory is that there can be a genetic basis, but mostly it's an acquired condition. So the sort of symptoms that you can get, the entire gut can be affected. The esophagus is not usually affected in CIPO, but some patients can have difficulty with swallowing. If the stomach is very delayed in its emptying, you get early fullness, bloating, nausea, vomiting can occur. In the small intestine, if that's not working very well, bloating is a main feature, just a lot of pain. Bacterial overgrowth we've talked about, which can cause both bloating and pain and malabsorption, all of those factors. Large intestine, of course, constipation, pain and bloating, and diarrhea, which can be either due to overflow, it's just so full up that the only way that stool can escape is by breaking down and coming out as liquid. Or we've talked about malabsorption caused by bacteria. And then you can get these episodes of more severe obstruction. So you may have these milder symptoms throughout, but then you can have more severe episode of obstruction when there is no physical blockage, but there's very severe pain, distension, inability to pass flatus or stool. So in terms of management, you try and find the cause through appropriate investigation. You try and improve gut function, reduce the secondary effects of a sluggish gut, improve nutrition, reduce pain. All of these factors are important, and through the rest of the day, colleagues are going to be talking to you about all of that. That's it. Thank you. Thank you very much. I suppose if there are any